Hi everyone, I'm Rustom Lawyer, CEO at Augnito, and welcome to the sixth episode of RAD Voice, where we discuss perspectives from the radiology community. We are very honored to have with us a leading voice in the radiology community, Dr. Anirudh Kohli, who is head of imaging at Breach Candy Hospital. Dr. Kohli has recently published a widely read editorial in the Indian Journal of Radiology and Imaging, sharing some valuable tips on getting back to work. So welcome, Dr. Kohli. Welcome to RAD Voice.
Thanks, Rustam. Good to see you.
So, Dr. Kohli, what are the four broad aspects to be considered as a radiologist when you have to return to work?
I think the first fundamental thing is, of course, being safe, because you don't know who you're going to come across with, and this happens on a daily basis. In fact, just half an hour back, it happened that a patient came and got a sonography gun, and then on the way outside, look, I am a COVID suspect, and so this is going to happen in your practice. So you can't just wait and say, okay, is he COVID positive or not? You got to treat everybody as a COVID suspect, as a COVID positive. So you've got to have your protection in place. So the most important is your N95 mask, and they've become so cheap and so easily available, which is one of the great things that has happened in this whole process. So your N95 has to be your best friend, and it has to be on you all the time. Of course, it's your question mark whether you're going to wear PPE or not, and that, there's a lot of controversy whether you really require PPE or not. If you're comfortable wearing PPE, wear PPE. Again, the prices have come down tremendously. So it's all available, not like the West where they don't have access to all these items. So that is protection. The second is obviously is that, you're going to have to surface decontaminate. We still don't have a fix on it, whether fomites are really an issue or not. So after every patient, the table needs to be wiped down with sodium hypochlorite and decontaminated for the next patient. So these are the two important parts. The third would be, of course, social distancing. And for that, we practice actively, where we've actually reduced number of patient chairs, reduce the number of patient appointments, space them out. So one, that there is social distancing happening from the patient side, as well as social distancing happening within the department, because we just keep a skeletal staff. Because one is, initially in the pandemic, we were only encouraging people who were doing requiring emergency investigations. Then, of course, with unlock, things have opened up a bit, but still there is a huge fear, and patients are not coming to the hospital for investigations. Yeah. So we actually don't have that much of a volume. So there's no point in having 5 people crowding around when there isn't work for 5 people. So we are very, we separate them. We, of course, have done another important thing. We put them into teams, so that, you have teams. So in case one team gets exposed, they go into quarantine. It's not that the department goes down. So you have the other teams which can take over. So we're very, very careful, and we segregate these teams out. So the social distancing happens from this point of view, reducing the number of staff and getting people to work at home and work from home.
Yeah, that's really good. Excellent advice, I think, for people in the industry. And, another aspect is there's clearly been an economic impact on the radiology sector, with a vast majority of imaging being done on COVID-related cases. Do you see the sort of change in the industry? And, when things return back, do you see things returning back even stronger with sort of leaner processes in place because of this?
Oh, yes, absolutely. And I don't know when we're really going to be able to return back totally, because things are not good. I mean, it's easy to say that a vaccine will come, but a vaccine comes, how do you dispose a vaccine and dispense a vaccine to 130 crore people? It's easy to say that there's a vaccine available, but more importantly is going to be how are you going to distribute it, and who's going to get it, and who's going to give the jab. And it's a humongous task. And will it take a year to do, or 2 years to do, or whatever? You might see people saying, I'll do it in 73 days and things like that. That's not a possibility. Yeah. So I think when are we going to get back? I don't know, but we've got to just plod on and continue. And actually this is giving us breathing space to do a lot of things, to relook things, as you rightly said, get our processes leaner, because we're going to have to do that. Because I'd like to just sidestep onto two interesting things that we looked at in this period of time. One is that work volumes crashed. So we looked at the work volumes crashed and we wondered whether it was our work volumes only which was crashing or everybody around. So we did a study with a public hospital, Sion Hospital, which is a teaching hospital, 1900 bed hospital, and the Breach Candy Hospital, where we looked at January, February, which is pre-lockdown. We ignored March because that was peri-lockdown. You know, we were all sort of winding up at that time. Yeah. April, May, which was lockdown, and June and July, which is unlock 1 and unlock 2. And we looked at the volumes across imaging, X-ray, sonography, CT, MRI. And it's surprising that both institutions showed a huge drop in volume over this period of lockdown as well as unlock. Unlock, things didn't change. So we were kind of surprised that for 4 months, where have all the diseases gone? So said, okay, so people are only coming for emergencies. So we looked at emergencies. We looked at stroke. We looked at heart attack. We looked at fractures. We didn't look at head injury because everyone's off the road. So, and the local trains are closed. So we looked at these 3 areas. And these 3 areas, what we found was that even in these 3 areas, that there was a considerable drop in investigations. So the number of strokes have gone down, number of heart attacks have gone down, number of fractures have gone down, which is really surprising. So this was an interesting fact, and which might have an impact, because what were the reasons? So we looked at different reasons. That one is inter-district travel was not possible because, you know, a lot of patients come to Mumbai from outside, but medical travel was allowed. But that should not affect strokes, because stroke, somebody can't travel inter-district to come. They have to go wherever it is close by. And the second thing is that clinics are closed. Health check programs are closed. So there's no engines to provide cases. But you can't explain the lack of emergency investigations being done. So this is probably going to spark off a lot of people. As you can see, that there's so much introspection going on in every field, that there's going to be a lot of people who are going to say that all these investigations being done are really superfluous. All these, you know, cholesterol checks. And so you're going to have that whole group of activists who are going to really get around and say, look, there is a big industry being created out here. So we may start to see some volumes drop, and we may not see those volumes come back. But maybe it's the right thing. There'll be a more judicious use of investigations of hospitals and things like that. So I think we just have to look at it, that the good is going to come out of this. And as you come back to what your point was, that leaner is going to be the way to go ahead. And I think we'll have to all get leaner on whether what equipment we buy and all our processes that we do. The second thing that I wanted to talk about, as I said, sorry to interrupt you, was it's also actually part of the first question. So what has happened is that antibody testing is available today. And what we know is that there has been a lot of asymptomatic infection, especially in the younger people. So when we started off, we went into this safe practice in a huge way. We have a staff of 53 people in the imaging department. 7 of them tested RT-PCR positive in these last 4 months. 4 of them had symptoms, and they came from containment zones in the early part of the pandemic. And that is how they picked it up. We were concerned also that are our infection control practices good or not good? Is PPE working or not working? And when and we got 3 more positive on contact tracing, and they were asymptomatic because they were in contact. A CT scan technician was positive. The doctor sitting next to him naturally picked up the infection, and all recovered beautifully. So we did antibody testing when the antibodies came, and to our surprise, 23 out of 53 had antibodies. That means 23 out of 53 had been exposed to the virus, nearly 40%. And what was interesting is that groups like us, the consultants, who would just flit in and flit out and, you know, play a Tom and Jerry game with Corona, we didn't have antibodies. And we came in our cars and we left in our cars and we stay in an isolated environment. Whereas the people who were traveling by public transport and coming to work, they all picked up antibodies, most of them.
Yeah.
And groups which were not meeting, like say the nuclear medicine technicians, mammography technicians, because we weren't doing these investigations because they're not emergency or urgent investigation, didn't have antibodies. But the X-ray technicians, the ward boys, groups of nurses, and some of the back office staff had antibodies. And that was basically because coming from containment zones and traveling. More importantly, between the X-ray technicians and ward boys, what we found was that these guys would have lunch together. They'd have tea together. And at that time, they're unmasked. And some of them would even spend the night in the duty room because they didn't want to travel all the way back. And that's how the silent infection has gone. So now the flip side at the end of 5 months is that 90% of my X-ray technicians have antibodies. 50% of my CT scan technicians have antibodies. 90% of my ward boys have antibodies. So basically, the department has become an extremely safe place. And what is the advantage is now that the people who have antibodies, I can put them at the front line. I'm not worried about them getting infected now. And also, I mean, I'm proposing to do something which is a little questionable, is actually give them little badges to say, I have antibodies, I'm safe. And this might bring back confidence into patients to say, yeah, I'm going to get handled by somebody who's safe and I can't get COVID from them.
Yeah, no, that's really interesting. Very, very interesting insight. Just sort of leading on from this point about making processes leaner, could you elaborate a bit on some of the new technological systems that have gained popularity during this period and which you believe will continue to drive efficiency even as the pandemic recedes?
I think it's going to be a lot of reliance on electronic medium, whether it starts from appointment scheduling. I think appointment scheduling is going to go bigger formats, go away from registers and, doing things online. Second is going to be giving instructions to patients. Patients whose relative would come one day before, take instructions. So I think a lot of it is going to move to the telephone, which should have been done. But just the pandemic is forcing us to do that. So patient scheduling, patient counseling, giving them all the procedures and what to do. And of course, then comes the major part, which is creating the report where Augnito has played such a strong role. We were fortunate that we started to use Augnito before the pandemic. So when the pandemic hit, we were all ready for it, and it's worked so brilliantly. I spend my parents are in Alibag, so I go every few, after a couple of days to just look them up, and because it's easy to go, and I can use Augnito there in Alibag, and I see my scans on PACS, and I dictate on Augnito. So it's changed life, and it will change every radiologist's life, believe me. The people who may not be happy are the transcriptionists at the back. Okay, but the point is that they are also getting a benefit because they're sitting at home. They're getting the dictations at home, and everything can be done. So it's making a huge difference, and it's actually increasing our turnaround time tremendously, because now actually you can just do an Augnito dictation and just WhatsApp it to the referring doctor or the patient. It doesn't have to even go to the transcribing and the back office.
Yeah, no, thank you so much for all your support and working with the system. I think we've been working together for quite some time now, so it's been great.
I think the mobile app is a killer.
Yeah,
it's really the killer. I mean, that mobile app has just upped the bar so much. I can't tell you. It's like a 10x step up.
Great, thank you so much. No, it's great that coming from someone like you. So thank you. Just a little bit of sort of advice for healthcare professionals who are getting back to work. How would you advise them to sort of, the psychological impact of and the apprehensions and fears of this new normal? I mean, what's your advice to them on that?
So I think what's the good part of the pandemic is that we've seen that when it started, and Mumbai being the epicenter, we were spooked by the numbers coming out of New York and Italy. And now that we see that it's not a severe infection. And the ones who are really getting affected are basically diabetics and people who have metabolic syndrome. And that's where another area where I think that we're putting out an interesting paper is that we actually looked at the patients who had a positive CT scan because they have a pneumonia. And we found that 25% of those patients had a fatty liver. And out of those patients who had a fatty liver, we get something known as a CT severity score, or a percentage of the lung involvement, which actually correlates very well whether they need to go onto a ventilator or whether they'll require high flow oxygen. So it's a very useful means of triage. We use it to decide whether they can be managed at home, whether they can go to the ward, whether they can go to the HDU, or they need to go to the ICU. And that's very important in a pandemic setting when you're seeing influx of so many patients. So it helps the decision-making process. So coming back to the fatty liver part, what we found is the guys who had fatty liver, guys because 2/3 are males affected in this condition, and the ones who had fatty livers actually had much higher percentage of lung involvement and poor CT severity scores, and actually did worse. So a fatty liver may be a very good prognostic indicator to telling you that this is somebody who might not do well. Sorry, I'm continuously digressing away from your question.
No, very interesting.
Because these are all exciting things that we're doing in COVID. So I thought I'd just share it. So coming back to your point about getting the environment safer, as I said, you got to consider everybody's COVID positive. You got to understand, looking at the figures, it's a mild infection. There are only select groups like diabetics and obese who are getting hurt. So even if you do pick it up, don't worry, you'll settle down, you'll do well. But that doesn't mean you walk in and pick it up. So use protective equipment. Use your N95 is by far your best friend. And you should know how to don it and doff it well. Don't touch the front of it. Be careful. Just be sensible. Wash your hands, use your mask, and keep a social distance. And that's it. And things will be good. And I think patients slowly will develop confidence. This will become a new normal, and we'll go back to what things were before.
Yeah. So thank you so much, Dr. Kohli. Brings us to the end of our little chat. And, most importantly, thank you so much for providing such a great service at this time. So thank you.
So can I ask one last question before you go?
Sure.
So what's next from Augnito after the mobile app? Because I can't think of anything more you can do, but I'm sure that there's something.
There's a lot of
have a sneak preview.
Yeah.
What's going on in your mind?
There's a lot of interesting work that's going on the R&D front. One of the areas that's very interesting for us is the whole ultrasound area. So should be something coming up very soon, which will be excellent for people using ultrasound as well. So,
okay. Yeah. Okay. Yeah, they have to put in a lot of numbers.
Yeah.
So that is a one pain in the butt for them.
Yeah.
So good. All the best.
Thank you very much. So thanks for watching, everyone. We're very excited. Of course, Dr. Kohli had mentioned this, but we're very excited that we've launched our Augnito app. So you can try the power of voice recognition directly on your phone. The app is free to use for 30 days and is available on both iOS and Android. So do try it out. And thank you, everyone. All the best.